Okay, today I'm going to be doing a newborn assessment on my teddy bear here. So first thing, I would walk into the room and introduce myself. Hi, I'm Katie. I'm going to be your student nurse today. And then I would go ahead and ask the parents how they were doing, how the baby was doing, and let them know what I would be performing. If the baby is being held and they're content, you can leave them in that position. Obviously, for today, I'll have my baby laying flat on the bed. Um, so first thing we're going to do is we can count respirations. We can simply do that by watching the abdomen, or we can place a hand lightly on the abdomen just to count respirations. Babies do take breaths from their abdomen. So that's a good point. And a newborn is going to have a higher respiration rate than an adult, so don't be alarmed. And then I could go ahead and take a look at the appearance of the baby, noting skin color throughout the extremities. I could go ahead and engage with the baby and see if they are engaging back or making noise, depending on how old they were, how they were engaging with me. You can see if their eyes are following any cues. And then I would go ahead and I would auscultate the lungs. So for a baby, you're going to listen to the bases of the lungs at the sides of the abdomen. And then for listening to their heart rate, you want to find the apical pulse, and you're going to listen there for a full minute. And then again, I can go ahead and check the skin for warmth. I want to check perfusion at the extremities. And then I'm going to go and palpate the central pulses. So on a baby, that is brachial, so under the arm here. And then also femoral, which is easiest to do during a diaper change because it's right along the diaper line there. So I go ahead and would count that, check that for a full minute. If we flip the baby over, we can go ahead and when they're kind of on their back, we can go ahead and palpate the spine as well, just to make sure it's normal growth and development. And then we can assess their hydration status by feeling the fontanelle at the top of their head, so a little soft spot. It should be flat and smooth. If it's sunken in, that could be a sign of dehydration, but we also don't want it to be raised because that could be a sign that there's increasing pressure in their head. Just kind of note movement. Lots of babies will be wiggly or kicking around, especially during a diaper change. We can go ahead and we could shine a light really quickly. It's hard to get them to concentrate, but shine a light quickly, check for pupil dilation. And then babies will have the stump of the umbilical cord, so we're going to take a look at that. We're not going to do anything much to it, just check underneath it for signs of infection or any skin breakdown, and we'll let parents know that we clean that with warm soapy water. You can ask the parents about toileting, like how many poopy diapers has the baby had, how many wet diapers has the baby had. Make sure you ask about how often the baby is feeding. And then if it's time, we could do their 24-hour weight check to compare to their birth weight. And we're expecting babies to lose less than 10% of their birth weight within the first couple days. Okay.